Hello and thank you for joining me. My name is Dr. Warner Carr, and I'm a practicing allergist located in California. I would like to share with you today why I chose to treat with TEZSPIRE, tezepelumab-ekko, the first and only biologic approved as an add-on maintenance treatment for adult and pediatric patients 12 years and older with severe asthma without phenotypic or biomarker limitations. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. It is important to know that TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab or its excipients. Reactions, rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. We'll cover additional safety information throughout the course of this video. In two pivotal studies enrolling a broad, all-comer patient population, meaning no baseline biomarker level requirements, TEZSPIRE reduced asthma exacerbations by up to 71% in the Pathways study and 56% in the Navigator study compared to placebo. In addition, TEZSPIRE is the only biologic to demonstrate a statistically significant reduction in exacerbations in patients with blood eosinophils ranging from 0 to less than 300 cells per microliter. Reductions in exacerbations, regardless of phenotypic profile or biomarker level, were observed in patients taking TEZSPIRE. In a post-hoc pooled analysis of Pathway and Navigator, fewer exacerbations were observed in patients receiving TEZSPIRE versus placebo, regardless of baseline blood eosinophil count, fractional exhaled nitric oxide level, or allergic status. Results of this post-hoc analysis are descriptive only. TEZSPIRE provided rapid improvement in lung function that lasted. Treatment with TEZSPIRE improved FEV1 by 230 milliliters over baseline at 52 weeks. Moreover, 70% of the lung function improvement was achieved at 2 weeks. Please note that TEZSPIRE is not a rescue medication. Changes in asthma symptom control and asthma-related quality of life were evaluated as secondary endpoints in the Navigator study. Compared to placebo, improvements were seen in patients treated with TEZSPIRE in the Asthma Control Questionnaire, ACQ-6, and the Asthma Quality of Life Questionnaire, AQLQS-12. Please note, do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live, attenuated vaccines. After seeing the results from the TEZSPIRE clinical program, I started to think broadly about how I could incorporate TEZSPIRE into my clinical practice for patients with severe asthma. When a patient comes under my care, they have typically been living with severe asthma for years. In many cases, it's clear that asthma has had a major impact on their lives. And I feel it's time for my patients to take steps towards better controlling their asthma, with the intent of getting back to the activities they used to enjoy. I feel a sense of urgency with each patient, and my immediate goals when evaluating a new patient are the following. Confirm the patient has severe asthma. Evaluate what we refer to in my practice as asthma vital signs, which include exacerbation history, biomarkers, lung function measurements, and asthma-related quality of life measures, and gain better control of symptoms and exacerbations. I start by optimizing inhaled therapy and addressing any comorbidities that may contribute to a loss of asthma control. After these steps are taken, if patients still remain uncontrolled despite optimized inhaled therapy with a high-dose ICS-LABA and addressing relevant comorbidities, I know that I can start a patient on TEZSPIRE as a first-choice biologic treatment. Allow me to share several aspects of the TEZSPIRE clinical data that stood out to me as I thought about my patients with severe asthma. First, TEZSPIRE was shown to reduce asthma exacerbations in a broad all-comer patient population with severe asthma, meaning no biomarker or phenotypic limitations. That reflects a spectrum of patients I see in my practice. Second, in the Navigator trial, Treatment with TEZSPIRE was shown to impact the 3 biomarkers I measure as part of my workup of a patient with severe asthma: total serum IgE, blood eosinophils, and fractional exhaled nitric oxide. Biomarkers allow me to better understand my patient's disease. But patients with severe asthma can be started on TEZSPIRE irrespective of their biomarker profile. Third, treatment with TEZSPIRE was shown to improve FEV1 as early as 2 weeks, with statistical significance compared to placebo established at the end of treatment, which in my opinion can be meaningful for patients. In addition to the safety profile information previously stated, I also discuss the most common adverse events associated with TEZSPIRE, which include pharyngitis, joint pain, and back pain with my patients. Together, we discuss the risks and benefits, which is important for shared decision-making and establishing a treatment plan that is right for each patient and their goals. I also explain that individual patient results may differ from what was observed in the TEZSPIRE clinical trials. As a first-choice biologic treatment, TEZSPIRE helps me to address the asthma vital signs I evaluate in my clinical practice, and it has the potential to help my patients who are living with severe asthma. Lastly, my patients and I discussed that they would come to my office every 4 weeks to receive TEZSPIRE by subcutaneous injection. Thank you for listening to my TEZSPIRE moment. I've just shared how I made the clinical decision to prescribe TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. You can review the full prescribing information for TEZSPIRE, including patient information, at tezspirehcp.com, or you can call 888-TEZSPIRE. That's 888-897-7473.